You look at any area of disease, asthma, lung cancer, prostate, diabetes, high blood pressure, men of color tend to die from these preventable diseases.
So it's important to engage this segment of the population in the healthcare system. The problem is that the traditional system doesn't seem to be one that's particularly welcoming.
The literature clearly shows that in African Americans specifically, when you are diagnosed, you're diagnosed at a much later state than your white counterparts, which limits treatment options, which limits sometimes your ability to live. I'm learning the influence of disease upon populations from the perspective of epidemiology. But I've also lived in some of these communities that have the worst health outcomes. I've lived in places with food deserts. I've lived in very violent neighborhoods. I lived in places that people say you should never even drive past. I have personal connections to those places and to the people that are living there and the people that are suffering there.
Health disparities are really the result of systems that are not culturally competent. It's the manifestation of distrust. There is a huge amount of distrust among men of color to medical institutions.
Think about the effects of racism on health and what that does to your chronic stress levels and what that does to your organs in your body and how that is slowly wearing and tearing away at you. Think about the history of the Tuskegee experiment and just some of the really dismal things that have happened specifically to African Americans. There is reason to not trust the medical system.
What the Barbershop Health Network is really all about is reducing health disparities and decreasing the early mortality of men of color. We focus on African American, Latino, and African men.
A number of people recognized that barbershops happen to be the places where these men come, particularly on Saturdays. So if you are going to do, what makes obvious sense, you go to the patient rather than expecting the patient is supposed to come to you.
First thing is the BHN shops, and those are all the barbershops, the local businesses that have partnered with us in a very participatory, active way. And so we actually go into the barbershops and do health education. We do non-invasive screenings.
The volunteers mostly that we'll be bringing into the Barbershop Health Network are white. Their experiences may not correspond with the experiences of the men that they will encounter in the barbershop. They could ask an African American man who is 40 years old, when was the last time you went to the doctor? And he may say never. And what that truly means to that man and what that truly means to a white volunteer could be two totally different things.
There have been a number of studies done in the United States that have identified that men of color from age 20 to age 40 just don't tend to see doctors, and they don't tend to be involved in the healthcare system except on an urgent or an emergent basis.
There are economic factors, not even being able to be fully employed or not having the money to pay for medications even if you do go to the doctor. So I think it's very layered, it's very complex.
Doc and Shop is an event. It's one of our community clinics. We have, MDs and specialists and medical students that volunteer their time throughout the day to provide these services. We hosted it in 3 of our 10 barbershops. All the services are free, from eye test to glucose screening to check for diabetes. We do high blood pressure screening. We also gave out free flu vaccinations this year. These are services that with someone copay could cost them, $100 to $200 in total in terms of the value of the day for those services.
we need to be very strategic in making sure that we are having a positive impact on the people that are there. It's really more about being culturally aware and understanding how to converse across differences.
You know, you're looking at an old white guy, and I don't pretend to understand all of the reasons why men of color might not feel comfortable in a system that seems just fine to me. But the reality is, if there are people who are outside, then my responsibility, particularly as a primary care provider, is to figure out ways of engaging folks, whatever that means. And if it means coming to barbershops on Saturday morning, that's what it means.
Because there is a crisis among not just Black men, but Latino men.
As we think about the browning of America, the fact that we will have a majority-minority demographic sooner than later, and that if we don't start taking care of some of these issues now, we're going to be in serious trouble very, very soon.
I think that our healthcare system needs to think far more broadly, and part of the way to do that is to have the people who run and provide services in the healthcare system reflect the community that that system is operating in. So we need more men of color and women of color who are going to be healthcare professionals in whatever way.
In my wildest dreams, I would love to be the Surgeon General. I feel like I would be an asset to the policy creation process, because so often I get disturbed by the fact that I think our policies are being created by people who have no idea who the policies are actually going to be affecting.
We know this has to be a system change. A program like Barbershop Health Network is needed across the country, and the statistics, then the data tells you why. Our vision is that Doc in the Shop will take place in barbershops all across the state on the same time and date, where we can screen thousands of men